overrun with the fake, delusional, and disingenuous. He stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, folks? Sorry I've been out of pocket for a while. Duty calls, job's been kind of getting at me. Numbers are picking up, as you probably know if you've been keeping up with it. Arkansas is one of the top places right now for increase in COVID cases and whatnot. So I'm probably going to cover that a little bit here as soon as I can get to it. Excuse me. But today, I want to talk about what most people are afraid to talk about. What you are told that you probably shouldn't talk about because of repercussions and whatnot. And that is this trans thing. Or as some of my closest confidants call them, LGBTs. Or LGBTs, or however you want to say it. But apparently there is a doctor who has been helping teens in the past to transition, as well as, with counseling and whatnot. And through her observations throughout the years, she is having some misgivings about this. So it's gotten so bad that she is changing her mind or her position on helping people who are questioning, or whatever the case may be, to go through the process to transition. So as you can see with the New York Post article there, it says, trans doctor, and he himself has transitioned, and they see it as problematic. But what she says is, the article says, is trans doctor who helps teens transition says it's now gone too far. It says Anderson previously told the Washington Post a fair number of kids are getting into it because it is trendy. So, in other words, it's cool to be one of the alphabet crew. So now kids are, that's the new cool thing to do. So kids are basically changing their genders and essentially mutilating themselves for the sake of being cool and accepted in society. A lot of us have already talked about how problematic this is, but I'm always shouted down on Facebook and, some of the other mediums that I go to, where these people are basically, they are, well, I'm for humanity, and who are you to tell these people that they're not what they are, and blah, 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 just all kinds of stuff. And why are you interested in it? It seems problematic that you're so interested in this. If you're not into the gay community, or you're not gay, then why do you care? Now, we're getting this from black women who basically feel like they should be able to tell me as a black man what I should care about, what I feel is problematic for our community, why I feel like kids should not be allowed to make decisions like this if they can't make decisions to smoke, drink, a number of things. You can't even go into the military until you reach a certain age. And you can't drive a car until you reach a certain age. But for some reason nowadays, we can allow people who are 8 years old to basically say that they want to transition. And it's ridiculous. I appreciate, Matt Walsh's work on this. I posted some of it because he asked pertinent questions, and people are now afraid to even say what a woman is or what a man is. You can't say real woman, real man. You can't say any of those things. You can't discuss hormones or physiological differences between men and women. You can't do any of that. But I digress. I'm going to go ahead and get into the article. And we're going to take a look at what she has to say about it. All right. So here we are. Doctor who helps teens transition, says it's now gone too far. This is by Lee Brown, the New York Post. All right. A transgender psychologist who has helped hundreds of teens transition has warned that it has gone too far and fears many are making life-changing decisions because it's trendy and pushed on social media. Okay. Erica Anderson, 71, who is transgender herself, told the Los Angeles Times that she is horrified that even 13-year-old kids are now getting hormone treatment without even meeting with psychologists. I think it's gone too far, said Anderson, who until recently led the U.S. Professional Society at the forefront of transgender care. For a while, we were all happy that society was becoming more accepting and more families than ever were embracing children that were gender variant. Now it's got to the point where there are kids presenting at clinics who parents say, this just doesn't make sense, she said. Anderson is so concerned, in fact, she said she is considering ending her own pioneering work helping teens transition. I have these private thoughts. This has gone too far. It's going to get worse. I don't want any part of it, she said. Okay. Erica Anderson, transgender clinical psychologist, said teens transition have gone too far. Okay. And they show pictures of her. Okay. Him. I worry that people will accuse me of setting the train in motion as part of those who advocated the affirmative approach to gender in youth, even though that's not a reasonable account of what happened. She believes that the dramatic rise in teens seeking treatment is likely driven by peer pressure as much as wider acceptance of trans issues. A fair number of kids are getting into it because it's trendy, she previously told the Washington Post. I think in our haste to be supportive, we're missing that element. Okay. And I think those of us who are reasonable have been saying this all along, that it's being pushed. That's why, the whole term, alphabet mafia is out there, because it's being pushed. There's so much momentum behind this trans movement that it has dwarfed everything else. There's so much money behind it that, it is detrimental to your health for you to even question it. Okay. So in her latest interview, she told the LA Times to flatly say there couldn't be any social influence in formation of gender and identity flies in the face of reality. Teenagers influence each other. That appears to have been exacerbated by the pandemic, with children becoming more isolated and also learning more on networks on social media. What happens when the perfect storm of social isolation, exceptionally increased consumption of social media, the popularity of alternative identities affects the actual development of individual kids, Anderson asked the LA paper. We're sailing in uncharted seas, she warned. Anderson readily shared her birth name, Eric, and her story of how an endocrinologist, refused to prescribe hormones and left her feeling deeply ashamed when she first sought them at age 45. She finally got them at 58 and had genital surgery at 61, thrilled to finally become a woman. But while thrilled that the world is now more accepting, she fears it has swung to an extreme, noting a 13-year-old patient whose pediatrician put him on testosterone, even though he had not met with a psychologist. Okay, so that must be a her who was getting testosterone in order to transition towards being a him. All right, so here we go. Why is this kid on testosterone so precipitously? Anderson asked. Anderson, a member of the American Psychologists Association committee that is writing guidelines for transgender health, believes some children seek treatment in the hopes that it helps with wider psychological problems, leaving them depressed when it doesn't. She insisted that those allowing medical treatments for kids without rigorous psychological evaluation risk committing malpractice, something that we've all said. So those who are confused about their gender identity also need to wait until they are absolutely sure before acting, she said. I have a dictum. When in doubt, doubt, she told the LA paper. Questioning is a good thing. How are you going to find out if you are lockstep with whatever conclusion you come to first? Despite her pioneering work, Anderson finds herself at odds with the trends to make it easier for anyone to transition. All right. Dr. A.J. Erickson, medical director of the Gender and Life Affirming Medicine program at the Anchor Health Initiative in Stamford, Connecticut, eschewed the need for therapy. Being trans or gender diverse is not a mental illness, and compulsory psychotherapy is not the standard of care in the gender affirming medical model. Eckhart, who is non-binary and uses they and them pronouns, told the paper, forcing transgender and gender diverse youth through extensive assessment while their cis peers are affirmed in their identity without question conveys to them that they are not normal. See, this is where we get off into, you got these people who have already, these people are part of the community. So they're biased. So they come in with a subjective, almost agenda to go ahead and allow this to be an easy process. This should not be an easy process, and it should not be compared to what they call cisgender people. I call them normal people. Okay, so when you compare this to a normal person who is a male or a female, you know, and then this person doesn't have to go through rigorous psychological training because they don't need any care. So that doesn't make any sense. If a person doesn't need any care and they're being being compared to a person who actually needs some psychological care, I mean that's an oxymoron. How is this person even practicing to say these things? And then you see they make up these you know, they go and they start these institutes. The director of Gender and Life Affirming Medicine program, you know, at the Anchor Health Initiative at Stamford, Connecticut. So what would they just made a building and made up this long name, and have a bunch of transgender people in there who will help other people become transgender. You know, how many people do they turn away who they feel are not right for the program? I'm interested to know those numbers. Or does everybody get to join the club? All they have to do is just come in there and just say, "Yay, I'm ready to, you know, to transition into a woman because I can have a better life." or because I'm depressed or whatnot, whatever the case may be. And then they just go and then they just help them to quickly get through this supposed, treatment plan, I guess, that they made up, and I'm going to look more into that because I'd like to know what the guidelines for treating these questioning transgender people are, and whether they have ruled out other psychological issues before they start allowing these people to transition. That's an important question to ask. But like I said, I don't want to put too much of me into this. But these are the questions that you should be asking. As a parent, as a person who's going to help people who are underage, to change into something else who might change their mind later on is just, this is crazy. Removing healthy tissue in order to make this person who sees themselves as something else to be whole is also crazy. But anyway, we'll get into that. I'm going to do a few more of these and delve into some of the medical issues associated with this. Okay. Again, forcing transgender and gender diverse youth through extensive assessments while their cis peers are affirmed in their identity without question conveys to them that they are not normal, they said. Okay. Any medical situation has to go through an assessment. So anything, if you go in, you have your finger broken, you have to be assessed. If you're, you lose consciousness, you have to be assessed. If you're exhibiting mental status changes, you have to be assessed. So, this is an asinine, premise that this person is putting forth. Okay. So as for Anderson's claim, the kids are trans just because it's trendy, Eckhart said, is it trendy to be one of the most marginalized and vulnerable groups? See, this is something else I take issue with. You know who the most marginalized and vulnerable group is? Black men. Hands down. Look at the data. But anyway, here you have that. Now, you have all of these, all of this, everything that's been discussed in this. Now we're going to go to this right here. And I'm going to let you guys listen to this and, fair use. This is World Star. But, yeah, take a listen to this.
What does it feel like to miss your penis?
I 100% feel like I was part of some cruel medical and social experiment. I wish somebody hugged me a few years back and be like, you know what, you can present feminine, you can wear heels, hair, whatever you want, but the sad reality, we don't have technology to make you an actual woman.
I've been asked my reasons for not wanting the surgery, etc. And people are like, well, yeah, maybe you won't be able to orgasm anymore. In their mind, their head goes to will you be able to still come afterwards? The reality is, for some people, and you're saying for yourself, you can't even have sex. You have had a sex change and now you cannot have sex.
Yeah, it was not a fair trade at all. So when I was convinced I was a woman, I was remembering how I was a kid waking up dreaming I had a vagina. And now I'm I wish I could go back. I made a huge mistake, Now the families that was here that was supportive of me, that live in America, the families that live in America, now the transition is pulling me further away from them because first of all, they're confused. Third of all, I feel a little angry. I just feel like they affirmed my delusions. And honestly, I feel a little angry towards them. I know it's not their fault. I own the fact that I signed on a dotted line, but I was just a traumatized kid. My sister, she grew up with me. She knew the conditions we grew up in. She knew that I was traumatized. But again, she was she's even younger than me. There's no way she could have known. But they kind of didn't protect me from myself.
Okay. Now, you got that. So, you guys all heard that. So you have a person who was traumatized as a child, and this person went through the transition process and they regret it. This person can't have sex anymore. They removed their penis in order to be a woman. And the person said also that these people affirmed his delusions. Okay. And all of the people who affirmed his delusions, now he feels he doesn't want to be associated with them because they did him harm. He wanted to present as a woman, dress like a woman, walk around and I guess do the pretty things and whatnot, but he really just didn't want to totally, let go of his parts. But these people can convince the person to do it, and then now there are complications. So I'm not going to make this one, too long, but there's a lot to consider there when looking at all of this. And people are out here, muddying the waters. Everybody from politicians to judges to even some doctors who are and nurses and across the board, psychologists, psychiatrists. These people are not objective, and you have to be objective to do the job. You have to be able to question these people and say, are we doing what's best for this patient? So I'm going to leave this here with you guys. I'm going to add these couple of links to this so you guys can check this out on your own. And I'm sure you'll, come up with some other things that you will want to ask yourself and others about this whole process, because nothing like this should be done quickly, and they say that this is not a psychological issue, but there is body dysmorphia, there is gender dysmorphia. So, these people see themselves the way they see themselves. They could be beautiful. And if they see themselves as being defective, they will ride that until their deaths. And it is something that is mentally stuck in their brains. So this is a slight deviation from the body dysmorphia, where people see themselves as being fat when they're not fat, and they will starve themselves to death, and become bulimic and whatnot, in order to achieve a certain look. And this affects men and women. So you have this gender dysmorphia also, which was a diagnosis in the DSM, and the DSM TR came out and it was removed, but it was removed because of political pressure, not because it wasn't real, but because political pressure was put on the governing bodies in order for them to remove that from the diagnostic manual. So if you can get your hands on the old one, I think it'd be a good thing to have, as well as the new one. But more and more, the data is leaning towards the old position. But society is moving quickly towards, transitioning anybody who wants to, and pretty much going towards a chaotic and non-rule affirming society, which is just going to lead to chaos. But I'm gonna leave it there. I'm rambling, and you guys hit me in the comments and tell me what you think. Again, sorry for the long hiatus. I will try to do better with that. And thanks for sticking with me and hanging in there. And until the next time, you guys have a good day, night, whenever you're listening.
I feel like a motherless child, a long way from home.